Grand Risings, Kings, Queens, Gods, and Goddesses, don't scroll, just listen. So, I was just here thinking about this big, beautiful bill that Trump just signed into law. So, I work at a county hospital where funds are already stretched. Y'all hear me loud and clear. We are dealing with a mental health crisis in America. And I know that nobody's paying attention to it. And I know that y'all feel like there's places where you can take your loved ones and you got things to do. No, you do not. The nurses, the doctors, the administrators, the psychiatrists, the behavioral health techs, the sitters, the nursing support techs, the PCTs, the CNAs, the LPNs, they are getting burned out very, very early because if you was to just to think about it, 20 years ago we had more mental health facilities to take individuals for them to go. I feel like that the United States is being modeled. They started this in Georgia. Just hear me out. They started this in Georgia. This big, beautiful bill was started about 25 years ago. And it was and they did a sample of it in Georgia, and we have been struggling. They took the housing from Georgia. The same thing that y'all are saying. They took housing. For one, you can't tell me somebody that just freshly got a Section 8 voucher, because there is none. Medicaid and Medicare. It's hospitals, rural hospitals, that has closed down in Georgia because of cuts that has happened prior to from the Trump administration and the Bush administration, as well as when we had Governor Zell Miller, Sonny Perdue, as well as Kemp, that we have cuts to Medicaid. They do not accept Obama sincerities. So a lot of us have never even seen what Obamacare is. 3, we're tired, y'all. We're tired. Not only are the acuity of the patients higher now, the patient, you may used to have a patient come in with 1 and 2 ailments. Now you got them come in with 10 ailments on top of mental illness or dementia or Alzheimer's. And they need total care, and they need for us to care. And nurses are leaving. Nurses are going into utilization management. They're going behind the scenes. They're not going into bedside nursing. Our health care is collapsing right before our eyes. And most people are not paying attention. Y'all looking at, they're cutting. It is collapsing from within. I have been in healthcare since I was 17 years old, and so much has changed in healthcare and public service. The things that you used to could get in public service. Okay, people aren't paying attention to the epidemic of STDs. We're having an epidemic of STDs because why? A lot of health departments are closing down. Those were the things that educated the community on the spread of HIV, AIDS, and STDs. That is not available. Public health departments is closing. The Department of Public Health, they have cut it so much. And listen, people, listen. It's already hard because there's not a lot of nursing homes. These facilities are filling up. We have patients that are just waiting on beds. They're in the hospital, and it's a trickle down effect. And this is very, very important. This big, beautiful bill is going to collapse healthcare. It is. So you need to be finding another way to take care of your loved ones. I got to start researching and looking into ways, because I do use my son who is disabled. He live with my mom. We use grants and things to get him the help that he needs, to get him the care that he needs for the things that he needs. And we're starting to look for alternatives, because we don't wait on the government. We know how this thing is running. And a lot of people who are receiving they want to take away subsidized insurance. They want that gone, because that was part of Obamacare. And subsidized insurance, I worked in subsidized insurance. I know it has its in the coverage, in the money out of pocket, the MOOP. I know, as well as getting claims approved. But that could have been reformed. And it did need to be reformed. I understand that. I get that. It does. It needed to be reformed. As well as abortions. It needed to be reformed because people got out of control. Yes, I believe in the 6-week heartbeat. And I believe that after 6 weeks a pregnancy, you should not be able to have an abortion. I do believe in that, but medically necessary, because things happen during gestation that needs for the medical, and only thing abortion mean is to die, to go, to leave, to abort. And they have took that term and twisted it all around, and you see what we have. We just had a woman who was brain dead, and the only reason why they took the baby because her body was starting to rot, which I told y'all that this is what's going to happen. Her body was going to start to decompose and shit down because her brain was dead. Clinical death and your heart being dead is two different things. Your heart can stop pumping, but your brain can still have activity. Once the brain stops, that's it. The body is dead. And y'all, we're gonna have to pay for these lawsuits. These lawsuits with these immigrants. Our great grandchildren is gonna carry this tax bill. Do you understand that? We got to pay for all these lawsuits. Garcia, he is taking the Trump administration to court for deporting him to El Salvador, calling him a gang member when it is no evidence that show that this man is a gang member. Who you think gonna pay for them lawsuits? We are. The things that he is doing to people, the things that is going on, the lawsuit that they're putting against Fox. Who you think gonna pay for that? All of this stuff that they're doing, they're just throwing. This rogue administration is just throwing things, and it's getting blocked. And as they are getting blocked, tons of lawsuits, monetary lawsuits, is coming behind this. They riding the wave now. They riding the red wave now. But listen, it's going to be consequences and retributions behind what is going on, because it's going to be a major collapse in healthcare. Y'all listen to what I'm telling you now. It's already strained. As any nurse, as any doctor, as any one of how strained it is to be in a hospital working, or be in a nursing home, or be in a psych, or be anywhere where it's in healthcare that you are working, even in the doctor's office. It is very, very, very strained in working in these places. And a lot of people are leaving. Doctors, nurses, surgeons, they are leaving. They are going to deliver for Uber. Do y'all understand what is going on with healthcare? India, look at the crisis that happened in India with their healthcare. It collapsed under a rogue government. And if y'all think I'm playing, how long do you have to wait in the emergency room right now? If you was to go to the emergency room to get care, and if you were admitted, how long would you have to wait for a bed to become available for you to be taken up to be taken care of? Just think about that. Those wait times going to be longer. Healthcare costs is going to go up. And it's going to be less and less professionals to take care of you. We got to make some changes, y'all, because this is going to be very bad. Asha.